So considerations for care during COVID-19. First and foremost, vaccinate, vaccinate, vaccinate. Beyond known allergies to vaccine components, there is no contraindication to vaccination. We do recognize that individuals who are on systemic immunomodulatory therapies may demonstrate a decreased magnitude and duration of response compared to the general population. But when we compare the risks of disease flare or perhaps the onset of new autoimmunity, we still recognize that the benefit of COVID vaccination is it outweighs these risks in individuals with rheumatic disease. So this is looking at, on the right, we're looking at the CDC recommendations for the additional primary shot and the booster shot in terms of the COVID-19 vaccination. So it includes Pfizer, Moderna, and the Johnson & Johnson vaccine. And this is essentially saying that if you fulfill the criteria for vaccination, so 5+ years, if you are an individual with an autoimmune rheumatic disease and you are on either high-dose steroids or other drugs that may suppress your immune response, and you received the Pfizer or the Moderna vaccine, your primary series of vaccinations should actually be 3 and not 2. So 28 days after your second vaccination, you should get a third injection for the primary series of the COVID-19 vaccine. The booster shot is then recommended for you 5 months after that third vaccination. I know I personally am a little bit behind on this because some of our patients they were not aware of this. This is relatively new in terms of recommendations, and so really important to get that information out there. The American College of Rheumatology is frequently updating their recommendations for the vaccination, and they also recently put out vaccination recommendations earlier this month. And they have a strong recommendation for the third dose and booster dose that I just mentioned. They are recommending using the same vaccine if possible for your second, third, fourth doses. And there's a strong to moderate recommendation for vaccination as soon as possible. If you have a lupus flare, it's fine. As long as you're not critically ill, you should be okay to get the vaccine. There's a moderate recommendation for pre-exposure prophylaxis with the monoclonal antibody, post-exposure monoclonal antibody for asymptomatic exposed or newly symptomatic patients. In terms of medication modification during COVID-19 infection, whether it's presumed or confirmed, it is recommended to hold immunomodulators. This is a moderate to high recommendation from the ACR. And then NSAIDs should be stopped in cases of severe respiratory symptoms, a moderate recommendation, and then restart medication. So this is always the question for our patients. When is it okay for me to restart my medication? If it is an uncomplicated case of COVID-19, so that means they had mild pneumonia or no pneumonia, and they were treated in the ambulatory setting or via self-quarantine, then they can restart their medications within 7 to 14 days of symptom resolution. If they have a positive PCR and they're asymptomatic, then you can restart your medication 10 to 17 days after the positive PCR. And then severe COVID-19 cases, restarting their treatment should be decided on a case-by-case basis.